The best way to learn medical billing and coding. Did you know there's a healthcare career that doesn't require direct patient contact, can be done remotely, and has incredible job security? Today, we're diving deep into medical billing and coding, a field that's absolutely essential to healthcare but often flies under the radar. If you're looking for a stable career with growth potential, this might be exactly what you've been searching for. Medical billing and coding are essential healthcare industry components, playing vital roles in financial stability and overall efficiency of healthcare institutions. Medical coders and billers ensure all parties involved in patient treatment and billing are accurately and efficiently processed. The healthcare industry has many stakeholders: insurance companies, medical professionals, billing companies, and service providers. An important, often underrated sector is medical billing and coding professionals. Medical coding translates patient and medical information into coded language that healthcare facilities, insurance companies, and billing companies understand. This system allows disparate parties to efficiently process payments and ensure all service providers receive what they're owed. Accurate medical coding became even more important after the Affordable Care Act. Coders and billers use this special language to assess insurer payments to providers and determine what services patients can receive. What is medical billing? Medical billing creates healthcare claims submitted to insurance companies for medical service payments. This can be outsourced to third-party billing companies or handled by separate departments within healthcare institutions. What is medical coding? The American Academy of Professional Coders defines medical coding as using universal medical alphanumeric codes to translate health diagnoses, procedures, equipment, and medical services for research and billing purposes. Billing companies use medical coding to process payments and claims. The importance of medical coding and billing. Medical billing and coding services are crucial for diagnosing, treating, and billing patients. Highly trained coders interpret medical notes from physicians and technicians using correct codes to generate bills. Medical billers process healthcare payments and ensure correct amounts come from insurers and patients. They provide itemized treatment and procedure lists and ensure healthcare facilities receive timely payments. This robust system with skilled billers and coders ensures patients under special programs and insurance policies are covered and paid for by providers. Researchers also use this code system to track patient data and study treatment and disease trends. The benefits of medical coding. Medical coding maintains financial stability and overall efficiency of healthcare institutions. Here are its most important benefits. Reduced administrative burden. Medical billing takes considerable time and requires high accuracy, a heavy administrative burden for healthcare facilities. Third-party medical billing companies like NYBillPro reduce resource strain. They specialize in these services with expertise and technology to manage all medical billing procedures, allowing healthcare facilities to focus on patient treatment. Increased revenue. Proper medical billing ensures all bills are accurate and timely. Medical billers handle entire revenue cycle management for healthcare providers, addressing errors and leaks to ensure correct cash flow. Outsourcing to medical billers improves revenue flow through quick claim submission and processing. Their accuracy reduces denied or delayed claims. Increased efficiency. Medical coding and billing businesses have expertise in complex coding systems, insurance policies, and medical regulations. Their services improve overall system efficiency, processing more claims in shorter periods. Access to the latest technology. Technology constantly changes, and billing software continues evolving. Professional billing companies keep systems updated for accuracy and efficiency. Medical coding also changes, so billers stay current with industry developments. Artificial intelligence and machine learning now help automate medical coding, enhancing speed and accuracy while enabling companies to save overhead costs. How to learn medical billing and coding. Medical billing and coding careers require training to meet certification requirements. Look for programs offering comprehensive curriculums covering all necessary topics. Training opportunities ensure hands-on field experience. Research the field. Learn everything about the medical billing industry before choosing training courses. Research current trends and specific job duties for desired positions. Know what you're getting into to ensure it's the right career path. Enroll in a quality medical billing and coding program. Find and enroll in quality programs. You can pursue associate degrees or post-secondary certificates in medical coding. Certifications focus on specific niches, are affordable, and can be completed within weeks depending on chosen programs or specializations. Associate degrees cover data analytics, health policies, legal compliance, project management, and healthcare administration, taking up to 2 years to complete. Medical background and experience. Medical industry experience and human anatomy knowledge give you advantages when studying medical billing and coding. Previous healthcare provider work and billing insurance claims knowledge benefit billing training. How to get certified in medical billing and coding. Medical billing and coding promises fulfilling careers. Here's how to become a medical coder and join billing companies. Have a clear understanding of medical billing and coding. Starting medical billing careers requires deep understanding of medical codes used in billing processes. 5 types of medical coding classifications exist. Internal Classification of Diseases 11, ICD 11. Internal Classification of Diseases 10 Clinical Modifications, ICD-10-CM. International Classification of Diseases 10 Procedure Coding System, ICD-10-PCS. Current Procedural Terminology, CPT. Healthcare Common Procedure Coding System Level 2, HCPCS Level 2. Medical coders review medical records and assign codes for each diagnosis and procedure. Billers submit claims based on these codes, beginning payment processes. Know the types of coding and billing certifications. AAPC and American Health Information Management Association, AHIMA, offer certifications for those wanting careers in this field. Know where you want to specialize and how much time you can dedicate to courses. Basic certifications each organization offers. AAPC, Certified Professional Coder, CPC. Certified Outpatient Coder, COC. AHIMA, Certified Coding Associate, CCA. Certified Coding Specialist, CCS. Know the eligibility criteria. Certain requirements must be met for certified billing and coding professionals. Each certification has different requirements, often requiring high school diplomas or GED certificates. You must complete medical billing and coding programs, usually lasting 2 years. Some online courses last 4 to 6 weeks, while other programs last 4 to 15 months. Some courses require deep medical concept understanding. AAPC requires CPC certificate pursuers to know medical services, human physiology, medical terminology, anatomy, and coding guidelines. Choose certifications meeting career goals and fitting your background and current skills. Preparing for the certification exam. Exam preparation involves more than reviewing medical codes and billing guidelines. Take training courses and special programs if you lack required medical background or knowledge. Apply for AAPC membership and schedule exams. Exam training courses often simulate actual examinations to prepare for format and difficulty levels. Maintain your certification. After earning certification, maintain it to keep up with industry changes. Medical coding and billing norms continually change, requiring 36 continuing education units every 2 years. Medical and billing coding is a promising career. Medical billing and coding are essential services facilitating patient care and financial stability in healthcare. These professions require specialized skills obtainable through training programs and certifications. Medical coders and billers play crucial healthcare industry roles, ensuring efficient processing of patient information, billing, and payments. As healthcare continues evolving, medical billing and coding remain crucial operational components. Medical billing software like BillPro streamlines and automates billing processes, helping healthcare providers reduce denied claims, improve cash flow, and save time and resources. By automating billing, providers focus on delivering high-quality patient care while ensuring timely, accurate reimbursement. The medical billing and coding field is booming with incredible opportunities for the right people. Are you considering a career change, or do you know someone who might be perfect for this field? What attracts you most about medical coding, the technology aspect, or the healthcare connection? Share your thoughts in the comments below. If this video opened your eyes to a career you hadn't considered, hit that like button and subscribe for more career exploration content. Share this with anyone looking for stable, remote-friendly career options. They might just find their calling.